Recording. So today's speaker is Denise DuBois. She's sort of a newlywed, and so we sometimes call her by different last names, but her company, Realityworks, has been a tremendous partner for our consortium. We have a membership category for publishers and educational resource providers, and Realityworks has been a part of that, and they have just been a great partner and really willing to share and do these webinars. I think this is your second one, right, Denise?
Mm-hmm. Yes, it is.
And so we really, really appreciate their willingness to give you all resources and tools, not just what they sell, but also free and just some strategies that you may not have thought about that you could use remotely or in person. So with that, when you have questions, you're welcome to put them in the chat. I'm going to be sort of the Vanna White for Denise. And if I see a question, if she doesn't see it, I'm going to be helpful in making sure she gets it answered. And then we'll have a little bit of time at the end for questions. And then as mentioned in your reminder email about this Wednesday webinar, if you are interested in a certificate of participation, if that would be helpful to you to document your professional development, then you can email, I'm putting the email address again. It was in your message, but I'm putting it here. It's hsea@healthscienceconsortium.org. And you can email Shay at that address and just tell her you need a certificate of participation for today, and she'll get those out. We usually do it about a week later, and this recording will be up early next week. So with that, Denise, I'm handing you the microphone, and thank you so much for being here.
Well, thank you, Nancy, and I appreciate everybody attending today. Nancy, I'm going to share my screen. I think that means that you have to stop sharing yours.
I will. Thank you.
All right, there we go. Let me see. Let me know if you can see my screen okay?
We can see it.
Great. And I'm going to disable my video just to keep the sound quality as good as possible. So again, welcome to our session today on resources for engaging future medical assistants. It's my hope today to share many free resources that you may not know about, suggest some strategies, and make a lot of things available to you that you can try out in your programs, both teaching remotely and also in person. First of all, we're going to kick off the session with a discussion of soft skills needed by medical assistants, and we're going to share a couple of different scenarios that you can use with students in your program. So first of all, what soft skills are important to medical assistants? Well, here are a few of the qualities that a good medical assistant will possess. Soft skills like teamwork, empathy, and critical thinking are used, of course, every day on the job. And why do they matter? Well, we dug into the research, and we came upon study after study that showed the importance of those soft skills. And a few that stood out that I'd just like to highlight. First of all, we found one in 2013. It was a study by Millennial Branding that showed 61% of the managers and 65% of Gen Y people believe that soft skills are the most important ones you can have in the workplace. Then there was a poll conducted by CNBC in 2015 that revealed that 44% of employers chose soft skills as the biggest gap in the US workforce. And then recent research conducted by Harvard University and the Carnegie Foundation found that 85% of job success comes from having well-developed soft skills and people skills. And only 15% of job success comes from having those technical skills, perhaps also known as hard skills. So we know that it's very, very important. So health science, of course, has used the power of scenarios, for years to help teach key soft skills and technical skills. Sometimes perhaps a scenario will include the use of a simulator or perhaps a hands-on resource. Here you can see examples of two different ways to learn soft skills using simulators and scenarios. The first photo on the left is using a blood pressure simulator on a standardized patient. Now you could create any scenario you want and have one student be the medical assistant actually taking the blood pressure, they're learning it, and then for a specific type of patient or a specific type of reading, and then students can switch roles. One can be the patient and one can be the medical assistant. Now the added benefit, of course, of a wearable simulator, such as a blood pressure simulator, is that Student also gets the practice of the soft skill of patient communication. Now on the right, you can see there's a typical geriatric mannequin that can be used, of course, for a wide variety of scenarios to teach and to practice all sorts of basic medical assistant skills. You could set up a scenario with students working perhaps as a medical assistant in a clinic and then have them role play using communication and soft skills with the mannequin as well. Scenario-based learning has many benefits, whether it be for technical skills or soft skills, and here's just a few. We found that it creates those sticky learning experiences. Students will remember. It facilitates problem solving in learners, so it puts your students in those new and different situations. It will also provide guided exploration to learners, so that it gives your students those explicit, thoughtful, critical thinking opportunities. It always provides that safe practice zone to gain proficiency and mastery. So your students don't have to have a fear of risk or consequences. They can learn and master. It also allows your learners to make mistakes and through feedback, reinforce that right approach. So now is the time to practice so students know what to do when they come across these situations in real life on the job. We want to help them build their toolkit of responses and approaches. So one very simple yet effective way that we found helps students learn a variety of soft skills are with our pathway specific scenario cards. And we have these cards, they were written by subject matter experts. And on each card, it focuses on a different soft skill. So in our medical assistant career scenario card deck, there are 19 separate soft skills. Each scenario includes the scenario itself, points of view to consider, and key questions for discussion. We also have healthcare sets for, in addition to medical assistant, there's nursing, geriatric, EMT, and sports medicine. And we're going to share 2 scenarios from our medical assistant pack that you could use immediately online or in class with your students. So the first one we've got here is the soft skill of communication. And we know that scenarios are a great way to get your students to interact with each other and the content. So here's a medical assistant scenario as it relates to communication. Now, this would be perfect to use in a health occupations career exploration lesson, or if you just want to do like an icebreaker, or even a way to wrap up a lesson. But sometimes it's fun to have your students try their acting skills. So in this communication scenario that you've got on the screen, and I'll just read it quickly. It says, it's time for Adam's Relief to show up after working a long 12-hour shift as a medical assistant at a 24-hour urgent care center. He has only slept 8 hours in the last 2 days. He has been vomited on twice during his shift, and he's ready to go home and get some rest. Lori, his relief, has a history of showing up 20 to 30 minutes late, and today is no exception. Lori shows up 30 minutes late and does not offer an apology or explanation to Adam. So you could read this if you're in person, your students, they could read the card, they could have a small group discussion, or you can even scan this and post this for your remote students to read through and then answer those key questions. It could be turned into a writing exercise, or you could even put some of those key questions out on a discussion forum if you have an LMS system or something like that to encourage discussion as well. So even something little like this has got a lot of different ways that it could be used, both remote and in person, to have students explicitly think about specific soft skills. So this was one that we had on communication, and I've got another one that I'm going to share with you. The next one just happens to be on teamwork. So if you're teaching, again, in a remote environment, this could perhaps be scanned and shared in an LMS system, or you could even create a brief recording where you could read the scenario, and then you could put the questions out in a discussion forum for your students to weigh in on. Again, very flexible. So for teamwork, Jennifer arrives 30 minutes early at the pediatric office where she works as a medical assistant. She's hoping to eat her breakfast and drink her coffee before her shift starts. Dr. Henry, the doctor she works for, comes into the break room and asks if she'd be willing to skip her breakfast and clock in a little early. He has a patient that's coming in with a possible chickenpox, and he wants Lori to meet them at the back door so as not to infect the other patients in the waiting room. So again, students read that, they can think of through all the points of view of the people involved, and then they can answer those key questions. So that little card deck has 19. You've seen 2 here, so feel free to take these and try these in your classroom. Now, there are many ways to create short scenarios like these, but you don't have to do it all yourself. Here's a few pointers. First of all, you could get industry involved, especially in your local community. Many of you may already have advisory boards that you tap into for your various CTE programs, yours included. Talk to local employers in the area you teach. Tell them you're creating a class project and need help coming up with some real world scenarios that involve medical assistance. You could ask them about recent scenarios that they've experienced on the job. You could get your students involved. You could ask them to create scenarios based on some of their own life and work experiences if you were going to keep them more general to soft skills. Many students at that age are now employed in some of their first jobs, so having them share some positive or even some negative scenarios that they've personally seen or been a part of can be very engaging. Another place to go is talk to colleagues. More than ever, we have schools that are tapping into people from business and industry experience to teach. And maybe you know some of your fellow instructors in your school or even your district or your building that have worked in some of the areas, related areas that you teach. You could also ask them for a few ideas for scenarios. Also, don't forget about family members who may work in health science careers. You could ask them what types of situations or scenarios that they've seen or been a part of as well. But of course, if all else fails, you can Google it. If you do keyword searches on terms like work role playing, workforce scenarios, workforce conflict scenarios, all sorts of things will pop up, and some of those are ready to go, very short and something you could use right away. So I just did a little experiment myself where I put in, just in Google, medical assistant scenario. And I was surprised at the amount of things that came up that were scenarios you could use immediately. Here's just one example. It was all about getting and rooming a patient. It's about 6.5 minutes. It's on YouTube, and you could play that for your students and have them think through not only soft skills, but maybe there's also some technical skills in there that they could be thinking about as well. And on YouTube, I found actually quite a bit. So that might be one thing that you'd like to explore. Now, another thing in YouTube, if you want to learn soft skills, but not specific necessarily to health science, there are some general soft skills scenarios available out there as well. And we know videos are just a great way to get your students actively engaged in things like problem solving and critical thinking. So all it takes, again, is a few keyword searches, and I found dozens of these that came up. And there's just a few here on the screen that I came up with, but many more that you could show. You could even copy the link and you could embed that in if you're in a Google Classroom, or make it available to your students. You could show the scenario, you could stop and discuss as a class. You could even turn it into a writing exercise. How would you handle this? What would you do differently? So there's lots of different ways that you can use scenarios, and don't reinvent the wheel. There's a lot of things out there that exist already. You just got to find them. So that was a little bit on soft skills, but now let's talk about and look at some resources for teaching some technical medical assistant skills. Before we get on with more of the resources and ideas, I did want to share this Access site with you. The link that you see on the screen is all of Realityworks curricula and instructor guides for every product that we have for health science. We've made them available for the last year because teachers were asking us and wanting resources. So if you click on there, it will take you out to a page. I've got a screenshot here, and it says health science, and then there's different plus signs, and it will expand if you click. There's skills trainers, moulage, mannequins, anatomical models. Click on the area, the type of tool, and then let's say you click on skills training and maybe phlebotomy is of interest. If you click on phlebotomy arm, that will bring up the curriculum that goes along with that product, and there are just hundreds of free lessons. There are PowerPoints, lecture notes, assessments, all sorts of things out there at this link. So I did want to let you know that this is how you find that on our website at Realityworks.
Hey, Denise,
Yeah.
I know at the end, you're going to give them a place where they can go and
Yes.
capture some. Is this going to be there? Someone had asked me to put this in the chat, which I can, but You're
You
talking
can
to-
as a backup, but at the end on one of the last slides, we have created a special landing page for this webinar that has a list of all of the things that I'm referring to. So it's just like a one-stop shop that makes it easy to find everything that I'm referring to today. And this is there as well. But again, if you have problems finding it or forget it, whatever, we can certainly send it to you, or Nancy can put it in the chat as well.
Okay, I put it in the chat. I think
Okay.
I'm just checking my spelling
Yeah.
to make sure I did everything correctly. But I wanted them to know that while you're talking very fast, there is going to
I'll
be a
put
place for them. Oh, only because there's lots to cover, but
Yeah.
there'll be an opportunity at the end where you're going to give them some more information.
Yeah, so a lot of the things that I refer to when I say this is in our curriculum for XYZ, all of that can be found at this link. But again, at the end, we'll be having all of the links and all PDFs of all of the activities on one landing page that we'll give to you in the final slide. So you can look forward to that. So for blood pressure, this is a handout from our blood pressure simulator curriculum. And this is available again via the link that I just shared. One activity that you could do is you could take the procedures, and we have procedures in all of our lesson plans. You could type them into a Word document, you could scramble the order, and then you could challenge your students to put them in the correct order. Now in Google Docs, you could set it up so that each step has a correct number associated with it, so it could be auto-graded. But helping your students learn the procedures, especially while you're remote, is a great strategy, because of course we know hands-on practice really needs to be done in a skills lab for this. So we're trying to get your students all of the information they need to be ready, so it can save time when you are back in person. And we saw in the chat that some of you are doing just that. You're doing the lecture and all the content remotely, but then you're practicing those skills when you've got that really precious in-class time and trying to make the most of that. Now, here are a few more blood pressure resources that I found. One was an online self-test that's available at that link. It includes audio files as well as knowledge questions with an answer key, which I thought was quite good. And then the one below, it has an audio recording of the Korotkov sounds that students can listen to. And there's a few more out there, but I thought these two would be very helpful, especially if you are in a remote teaching situation. Again, don't worry about copying all of these links down. We've got all of the links provided at the end for you at that one landing page. So you don't have to worry about copying all this down. Now, this handout is from our Suturing Kit curriculum. And one thing to note is that for all of the student handouts and activities that I refer to on our website, there's also a Google Doc version found at the link that I shared, because we had teachers asking us, can you really make these Google Doc friendly so we can take these and use these in our Google Classroom easier? So there are versions of Google Docs for all the handouts I'm referring to. We know it's important to integrate vocabulary development into the lessons so that your students can understand and they can speak to the language of the occupation. So this is an easy way to include also core language art skills into your lessons. So this 2-page handout is from our Suture Kit curriculum. Now in person, in the lesson, there's a slide presentation that goes with this with tons of information. But for remote learning, you could prepare a lecture on the terminology using some of the slides from that lesson, and you could record it and you could share it. And then the vocabulary sheet information could even be turned into things like flashcards for your students to use for practice. One online resource you're probably familiar with called Quizlet is an online flashcard creation, a website. And here's a link where I actually found a free suture flashcard set that's already been created on Quizlet that is available. So something that you might find useful, especially if you are looking for remote teaching opportunities. So phlebotomy. This next activity comes from our curricula that goes along with our multi-purpose venous training arm. We had talked about those arms before, and it's found under skills trainers on that link that I shared with you. And it's part of our introduction to phlebotomy curriculum. So in our lesson, in our lesson plan template, every lesson starts with something that we call a focus activity. It's usually a brief activity, something to engage students and set the stage for the lesson. So here's an anatomy activity that could be used as an introduction to phlebotomy. So here, students will learn about the veins used in phlebotomy, and then they answer some very key questions. So something like this could be shared in an LMS system for your students to access. Now, here's also a short video that could be paired with that activity that's all about phlebotomy veins. And it's a rather short video, 5.5 minutes, but you can see how you could take a few free things like that and make a very nice little mini lesson for remote learning. Here's some more phlebotomy ideas that you could use to supplement a lesson content and bring some of that written content to life. Of course, there's a lot of videos out there you'd have to preview to know which ones were of high quality, but some are quite good. I also found some animated anatomical tutorials all about veins and things like that. Here's one link that I found with a screenshot. And then there are also some free phlebotomy apps available. One that I found was called Phlebotomy Technician. And then I also found another one called Mega Blood Draw Simulator. Now I can't speak to the effectiveness of these, but you could check them out as potential options perhaps. There is also a simulation provider called Simtix. I know some of you are familiar with this. They do offer a 1-week free trial. So if you were looking for something on phlebotomy, or if your students were, perhaps they could try that 1-week free trial and get some information for medical assisting for that venipuncture module that they have. So just a few things to consider out there for phlebotomy. For teaching ECG skills remotely, we have a 3-page ECG interpretation handout from our ECG simulator curriculum, and it goes along with the lesson that we have on the topic. In that lesson, there are lecture notes and slide presentations that you can access. Again, you could prepare a live session, you could deliver to your students or record it. You could deploy the written activity, these 3 pages. There's an answer key provided to you in our curriculum as well. So those are just some free things that you have available to you at the link that I shared earlier. If you're working with students teaching those ECG skills, if you happen to have your own type of ECG trainer or even a medical mannequin, you could use that to point out the lead placement locations and things like that. There are also some free rhythm identifications resources out there as well. The one that I've got on the screen here is one thing that I found. It was 12 lead ECG placement information at that website. There's also some online quizzes that I found. The first one was a self-grading rhythm interpretation quiz that your students could quiz themselves and see how they do. There's also a video on there that your students can access that you could take that URL or that video link and embed it in a lesson for your remote learners to quiz themselves. Are they recognizing those rhythms on the screen? Now, next we're going to share a few free resources available if you happen to have medical mannequins available. Now we've got 3 or 4 medical mannequins, and all our mannequins come with multiple lesson plans of which you have access to at the link that I shared. For example, we have an adult nursing mannequin, and I believe there's 10 different lessons that go along with that. And you could access that, but each of those lessons has soft skills integrated into them, patient communication, as well as the technical skills in the lesson. So we like to point that out. So here is one of the lessons that comes along with our adult nursing mannequin, and it's on intramuscular injections. So in this activity, you could actually use for in-person, hybrid learning, or remote. It's adaptable. So for remote learning, you could help your students learn that foundational knowledge. They could watch procedures to learn as much as possible before they get into the classroom, the skills lab, to get that hands-on training. So this handout that you see on the screen, it's to kick off the lesson on intramuscular injections. It's reviewing the layers of the skin and so forth. You could, again, post something like this on an LMS system. And then you could even prepare your own demo using a medical mannequin or a training arm that has intramuscular injection capability. And you could share that out with this a mini lesson on intramuscular injections. A few other ideas, of course, videos always work well, whether they be demos that you've done live or recorded. Always make sure they're as high quality as possible, that they follow the procedures that you want. Now, I don't know if this is a great idea or not. It's just one that I found. I'll leave it up to you, but I've seen some nursing students out there practicing injections on fruit, such as oranges, peaches. Now, I'm not advocating that. I'm just saying in this unusual time, it might be something to consider. But again, there's only so much your students will be able to do away from the classroom and skills lab. So getting them familiar with the right procedures and things like that. If you can get some of that information out of the way before they're back in person, then you can make the most of those valuable minutes you have with them in person. Now, I want to point out this, it's an acute injury scenario guide, and it's available to you on our website at that link under the nursing skills sim kit. There's one called adult acute care, and there are 3 scenarios that are provided in there. One is on ambulation, one's related to wound care, and one is related to IV insertion. But it's a very robust 38-page scenario guide that you can use. You can role play those scenarios with mannequins if you want, if you're in person, or if you're remote, you could prepare a video acting out the scenario using a mannequin. You could have your students watch that, and then you could share some of those or those debrief questions that are in that scenario guide. So there's a lot of different ways you could use these 3 scenarios to create a lot of learning opportunities for your medical assistant students. If you have a bandaging and wound care mannequin like the one you see in the picture, that can also provide hands-on practice in class. But if you're remote, one activity that you can take from our curriculum, and this is the curriculum from our bandaging and wound care mannequin, it's called the Dry Sterile Dressing Skills Checkoff. You could prepare a short lecture or recording using the PowerPoint notes in the lesson, and then your students can practice. So for at-home practice, they would actually need access to a dry, sterile dressing. This is something fairly low cost that perhaps you could prepare student dressing kits for at-home practice that could be sent home, or maybe students could pick them up. Students could practice on family members. They could record their dry, sterile dressing practice, and then they could submit it to you. So just a few ideas for if you still have remote learning. Now, there are many videos out there that address bandaging techniques. Here were just a couple, but I mean, there's dozens. This happened to be on amputation and applying a pressure bandage. Many of them are short, less than 5 minutes, that show the procedure and show the patient. So you could take those links and you could make them available to your students, and then you could discuss them. Now, we know that anatomy and physiology are prerequisite courses for medical assistants and, in fact, health science in general. So we'd like to share a free resource for teaching about diabetes education using our diabetic foot ulcer anatomy model. But perhaps you can take some of these ideas and use them for other anatomical models you might have access to. So we have this lovely diabetic foot ulcer model that we have, and we have a curriculum. It's called the Diabetes Education Kit curriculum that you have access to. The activity that we are highlighting here, it's an introductory handout, and it helps your students learn about those key anatomical terms that have to do with the foot. You could make this handout available to your students. And then if you have an anatomical model like this, or even have a medical mannequin that has a foot, you could do a live demo or even a brief recording pointing out some of those anatomical parts of the foot. Now, you also do have access to a very robust PowerPoint lecture regarding diabetic foot ulcers at our link. You could give students this assessment procedure, and you could have them practice on someone at home. There are many short videos that you could also post to pair with the assessment checkoff for more information. I've got one on the screen here that I found, but you can see how using an anatomical model can lead to just a whole series of activities or related lessons in a short time. But wait, there's more. Got a few more things that we'd like to share with you before we do open it up for Q&A. much like the Wednesday webinars that the consortium puts out, Realityworks also does webinars, and we do them each month on a wide variety of topics. You can go to the link that you see on the screen and you can register for them. They are free. We record everything just like the consortium. So after the fact, we send the recording out. You do get a certificate of attendance with that and any handouts that are referred to during the webinar. We also archive all of them, and we have dozens of health science related topics that you might find of interest if you go to the realityworks.com webinar part. So just wanted to point that out for you. Other additional resources, we have a blog, and we invite guest writers to submit lesson plan ideas, teaching ideas. We also have any new product launch information, testimonials, things of that nature out at the blog. We have a Facebook presence, and we're on Twitter. And what's really fun on some of our social media is when we see students actually interacting with some of our products and learning both remotely and in the classroom. So just a few resources we want to point out. But in addition to that, one of the most exciting new resources we've seen in the last few years is the Health Science Educators Association. And you can see the link here. They have a Facebook page that I think is one of the most interactive and engaging Facebook groups I've ever seen. The instructors on there, you could put out a question and get dozens of answers, and people sharing links and lesson plans and handouts, and just, it is a plethora of information. So if you haven't had a chance to check out joining the Health Science Ed Association and also their Facebook group, I urge you to go to that. Is an excellent source of information. Also, the consortium, they have tons of things available to you if you're not familiar. They have a lesson, they have enhancements that were updated in the last year that have been an enormous game-changing help to those teaching remotely. So if you want to learn more about all of the items that the consortium has to offer, just go to their website and check it out. You can ask Nancy, you can ask anybody on the board. We'd be happy to share more information with you. And don't forget about HOSA. They also have information and resources available. And I did notice that they do have competitive events for medical assisting, which I'm sure you're all aware of. So just some more resources to not forget about. So here is that link that I was said I would share with you, and it's at the bottom here. It's in the blue, and we will be making all of our stuff available to you at that link that you saw in today's presentation. But I would really open it up for any questions you might have at this point about anything that's been shared. And Nancy, have you seen anything in the
I do have a couple of questions.
Okay, great.
Well, first of all, they want you to post the link because they can't click on that. So it looks like you renamed it a link, and so they can't actually get to.
All right, I'm gonna actually stop sharing.
Okay.
And I'm gonna post that link in the chat so everybody can get that.
That'd be great.
Okay.
And so I'm not sure if you're able to multitask. Are you like me and you can multitask? I say most women can multitask.
Certainly we'll try.
So there was a question, and it was from, it was Melanie, I think. Was it? Melissa. Melissa was asking about the price of the simulation kits, and it was during the time where you were showing phlebotomy. And
was it the skills sim kit that I referred to for the acute injury scenarios, perhaps?
Can you give us you can unmute yourself, Melissa, is that what you're interested in? Or maybe you could just tell them where prices are available.
Yeah, we have 5 different skills sim kits available. They're $9.99, and in them you get the scenario guide, but you also get props, simulators, and other things that are used in the scenarios to make them more realistic and engaging for students. So if you go on our website, realityworks.com, you will find the 5 different skills sim kits that are available. We have 3 for nursing and 2 for CNA. But the one that I shared with you, that's just one of 5.
Okay, good. And you said $9.99.
Yep.
Okay, good. All right. That was a question. One question. And then there was a question from Miss Baxter, and she has some of the Realityworks resources for her classroom. And she was interested in maybe some technical support of how to best use those. So I don't know if that's something you all provide. If I don't know if you have people or you
We do.
Go ahead.
And I'm going to share my
I was going to clarify that just a little bit. We ordered the mannequin you were talking about with the skin mannequin and all that. I mean, I have that. I have the heels. I have things. They all came in right before COVID. And so then I didn't get to get them out, and I'm getting them out now. And I'm going, I didn't know about these lessons. This is great. I mean, this is really going to help me. So I'm glad I came. But and some of it I'm in the middle of right now. I'm like, oh, good, I can find that.
If you can you see my screen right now? There's an 800 number.
Oh, okay.
And there's also information at realityworks.com. If you reach out either by phone or by email, we have a product support team of a staff of 4 that are tremendous. If you have any information about using any products at all, reach out. We'd love to talk to you.
That's great. Yeah.
Thank you.
Thank you. That's great.
Okay, I'm looking here. I do appreciate the shout out you had there, Denise, about the Facebook page that for the Health Science Educators Association. I put the link there, but you also can just go to Facebook and search HSEA, and you should be able to get that. And I think there's about 1,100 teachers on there now, and I would agree that that page is really a vision of what we wanted it to be, and that is that tremendous amount of networking across the nation, and just everybody being so willing to share. And so we invite you all to, you don't have to be a member of the association to join the Facebook page. We'd love to have you as a member of this association. It's $45 a year, and you get some more exclusive classroom resources that go along with that. Okay, anyway, okay. The last page with the resource, let's see, is there any way to copy that last page with the resources and send it to those who are attending?
Yes.
Or will that be at that link that you?
Yeah, the link that I put in the chat there, that has everything on it.
Okay, so this link, the one that's realityworks.com/NCHSE, that one.
Yep.
Okay.
That's the one. Yep.
So does that work for you?
Okay.
Let's see.
Sure.
Ms. Baxter?
I just didn't see it. Sure. Yeah.
Okay. All right.
I will do that. And then I'll bookmark it. I'll put it in right now, bookmark it.
Did you all know that somebody from Wisconsin could talk as fast as Denise does?
I'm sorry. I got to slow myself down.
That's fine. I just have to listen fast because, I'm from the South. And so I just have to listen fast. You did a great job. Are there any other questions? Remember that if you're interested in a certificate of, I wanted to say one thing too before you start to leave, but I'm going to put this email address in the chat again. If you need a certificate of participation to document your professional development, just email Shay. She's our executive assistant, and she will get those out in about a week. I have had some of you ask about our upcoming conference. You know that we do sponsor the National Health Science Conference annually. And last year we did that virtual. This year, fingers crossed, it'll be a hybrid event. And so for some of you who would be so fortunate to travel, we'll be in Cincinnati, Ohio, in a magnificent hotel property, the Netherlands Plaza Hilton, and we'll be there October the 27th through the 29th. And then there'll be a pre-conference on the 26th. All that to say, the details about the conference will be posted on our website on May 1st. And if there's anything we can do to help you write a grant to be able to attend, we will have a hybrid part of this conference as well, because we know that hybrid is here to stay. And the main thing we want to do is make sure that we're giving meaningful professional development to you teachers. So you're getting a lot of thanks, Denise, and we thank you all for being here. We hope you'll consider coming back next Wednesday. How can a Wednesday webinar be on Thursday? Okay, we hope you'll consider coming back next Wednesday for the telehealth one. I think you'll be amazed at all that's being done in that area of medicine, especially impacted by the pandemic. So have a great afternoon, everyone. I look forward to hearing from you. If you need a certificate, look forward to seeing you at future webinars. Thanks again, Denise.
Thank you.
Thank you.
Okay, Margarita, I'm just looking at, do you have to subscribe to access the material? You want to unmute yourself? I'm not sure I understand exactly what you're asking there. Margarita Estrada? Or you can put it in the chat if you're shy.
No, I was high. I was just trying to figure out how to unmute myself for some reason. It's because I was bookmarking the the website for the NCHSE Realityworks. So you were talking about all the Google Docs and for the lessons and all that. So do we have to like subscribe and pay a monthly fee to be able to access this?
No.
No, free means free, right?
Yep, free is free. You just click and explore.
Gosh, where were you at the beginning of the year?
We gave it away a year ago. We've been trying to get the word out as much as possible. So.
Okay. Well, I'm glad we found you for now.
Yeah, I'm glad too.
Yeah, that's the beauty of this, right? That that you walk away with something that hopefully you can use in your classroom almost immediately. Okay, any other questions? Let's see. I just wanted to make sure I got that one. Looks like we're just getting names and getting thank yous.
Yeah. All right. Well, thank you, everybody. And
okay, well, anybody have anything else to share, or y'all just want to stay till 5 because you think I'll only give you a 45-minute certificate? Not true. Not true. You know you love your professors when they let you out early. So Denise is just trying to get extra credit for being a good teacher here today. All right. Thanks again, Denise.
You're welcome. Thank you. Bye now.
Bye, everybody. Do you get an invite for the conference? Melissa, if you're still here, do you mean, are we going to send out information about the conference, or is Denise going to be at the conference? Both. Okay. Denise will be at the conference and we will be sending out information about the conference, and it will also be posted at healthscienceconsortium.org under the events tab. I bet Denise will probably even be doing a workshop there.